اليوم شباب نحكي لكم على الانتستينال obstruction باختصار. طبعا classification of intestinal obstruction may be classified into two types, either dynamic or adynamic. Dynamic when there is peristalsis working against mechanical obstruction اللي هي either acute or chronic. Adynamic in which the peristalsis may be absent, for example paralytic ileus, or may be present but non-propulsive يعني ما تسوي حركة, for example mesenteric vascular occlusion or pseudo obstruction, in which in both type of mechanical element is absent in adynamic. Causes of intestinal obstruction: dynamic either intraluminal within the lumen, impaction, fecal impaction, common, foreign bodies, bezoar, gallstone. Intramural, for example stricture or malignancy. Extramural from the exterior, band, adhesion, hernia, valvulus, interception. راح ناخذ كل واحد بوحده. Adynamic, paralytic ileus, mesenteric occlusion or pseudo obstruction. Pathophysiology بالديناميك اللي هو mechanical obstruction, the proximal bowel dilate and develop an altered motility. Below the obstruction the bowel will be normal peristalsis and absorption لحد ما يصير empty, in which point they contract and become immobile. Initial proximal peristalsis is increased to overcome the obstruction in direct proportion to the distance of the obstruction. If the obstruction is not relieved, the bowel begins to dilate, causing reduction in peristaltic strength, ultimately result in flaccidity and paralysis. راح تتعب البول, تصير contraction against this obstruction لحد ما يصير flaccidity. This is protective phenomena to prevent vascular damage secondary to increased intraluminal pressure. The distension proximal to the obstruction two type, either gas or fluid. الغاز منين؟ الغاز يصير من ال overgrowth of the aerobic and anaerobic flora that confirm or تتحول إلى pathological flora. Okay? Fluid, this made up of various digestive juices following obstruction. Fluid accumulate within the bowel wall and any excess secreted into the lumen, while the absorption from the gut is retarded. Dehydration and electrolyte loss within the intestinal obstruction لها أسباب أربعة: either reduced oral intake, defect in the intestinal obstruction, loss as a result of vomiting, sequestration in bowel lumen. Okay, what is the mean by strangulation? When the strangulation occurs, the viability of the bowel is threatened secondary to the compromised blood supply. The venous retain is compromised before the arterial supply, وهذا معروف يعني البريشر بالارتري أكثر من الفينس, ولذلك الفينس راح ينسد قبل الارتري. The resultant increase in the capillary pressure lead to the local mural distension with loss of intravascular fluid and red blood cell intramurally and extraluminally. Once the arterial supply is impaired, the hemorrhagic infarction will be occurred. راح يصير hemorrhagic infarction to the bowel. Viability of the bowel is compromised. There is marked translocation and systemic exposure to the anaerobic organism with their associated toxin. لذلك بالstrangulation راح يصير toxemia and septicemia للمريض. The morbidity and of the intraperitoneal strangulation is far greater than with external hernia, which have smaller absorptive surfaces. The morbidity and mortality associated with strangulation تعتمد على the age and extent. The strangulated external hernia, for example, the segment involved is limited, short, and the result blood and fluid loss is small. When the bowel involvement is extensive, the loss of the fluid and circulatory volume will cause peripheral vascular failure. What's mean by closed loop obstruction? This occurs when the bowel is obstructed in both proximal and distal point. Well, a classical example of this when there is a tumor, for example, in the right colon, where competent ileocecal valve, so the colon between these will be called closed loop syndrome. واضح؟ Classical form مثل ما قلنا seen in the presence of malignant stricture to the right colon. Inability of the distended colon to decompress itself into small bowel result in increased intraluminal pressure, which create taste at the cecum with subsequent impairment of the blood supply to the cecum. So when it is unrelieved, lead to the necrosis and perforation of the cecum. نجي على نوع من mechanical intestinal obstruction. The most common intestinal obstruction here due to adhesions. In Western countries, the abdominal operation are common. Adhesions and band are the most common cause of intestinal obstruction. Furthermore, in early post-operative period, the onset of such mechanical obstruction may be difficult to differentiate from paralytic ileus. بالبداية بعد العملية ما قد تفرق بين الباراليتيك ileus اللي يصير بعد العملية وكذلك من early adhesions. The common cause of intra-abdominal adhesions is either ischemic area, so site of anastomosis, reperitonealization of the raw area, trauma, vascular occlusion, foreign material. الفورين material اللي تنسي inside the abdomen ما يسوي لها wash clearance by normal saline، فيبقى talc ويبقى starch ويبقى piece of the gauze، ممكن خيوط من الجوزة تبقى بالابدومن، silk. Infection, peritonitis, tuberculosis, this side cause of adhesion. Inflammatory conditions like Crohn's disease, radiation enteritis, all these causes of abdominal adhesions. Any source of peritoneal irritation result in local fibrin production, which produce adhesions between opposite surfaces of the bowel. Early fibrinous adhesion may disappear when the cause is removed or maybe become vascularized and may be replaced by mature vascular tissue. There are several factors that limit adhesion, prevent adhesions. For example, good surgical technique. كل ما يكون السيرجري clean كل ما incidence of the adhesion أقل. Washing of the peritoneal تونا قلنا should be washed the peritoneal cavity with the saline to remove the clot, piece of the gauze, silk, sutures, minimizing contact with the gauze. مو يصير rough movement of the gauze over the bowel. Covering the anastomosis and raw peritoneal surfaces. هذا مهمة جدا انه تغطي الرو area بالبريتونيوم. Numerous substances have been instilled in the peritoneal cavity to prevent adhesion formation, including hyaluronidase, hydrocortisone, silicone, dextran. هاي المواد كلها جربت حتى تقلل من الادهيجنز بالبول، حتى الستيرويد، حتى الانتيكوغولانت. Okay, post operative adhesion give rise to the intestinal obstruction. Intestinal obstruction usually involve the lower small bowel، يصير بالterminal ileum. Operations for appendicitis, gynecological procedure are the most common procedure. من يسألك يا أبي شنو العمليات اللي أكثر شيء تسوي intestinal obstruction؟ قل له appendicitis or gynecological procedure سيزيريان ورابعة are indication for early intervention. Band. This may be congenital or acquired. Congenital, for example, obliterated vitellointestinal duct, string band following previous bacterial peritonitis, abortion of greater omentum, usually adherent to the parietes. Okay? Acute intussusception, another example of mechanical intestinal obstruction. This occurs when one portion of the gut become invaginated within the immediately adjacent segment of the bowel. Almost invariably is proximal to the distal. يعني إليوم يدخل بالسيكم or jejunum بالإليوم. عادة البروكسيمال يدخل بالدistal. This condition is encountered most commonly in children with peak incidence between 5 to 10 months of age. About 90% of cases are idiopathic, associated with the respiratory tract infection, diarrhea, due to hyperplasia of the lymph node within the Peyer's patch, lead to the leading point. This lymph node consider a leading point to intussusception. عادة الweaning, loss of passive acquired maternal immunity, and common viral pathogen have been implicated in pathogenesis of intussusception in infancy. Children with the interception associated the pathological leading point such as microdiverticulum, polyp, duplication, henoxyolin berbera, appendix, inflamed appendix, usually older than those with the idiopathic disease. يعني عادة الأعمارهم أكثر ويصير عندهم interception. خلي ببالك ترى هذا leading point هي مو hyperplasia of the lymph node وإنما pathological leading point اللي هي Mickels, polyp, duplication, henoxyolin. Okay, after the age of 2 years, pathological leading point is found in at least 1/3 of the affected children. Adult cases are invariably associated with the leading point. يعني من يجي شاب وعنده interception لازم اكو leading point وهي هاي pathological مو idiopathic, which is usually polyp, Butis Jigger syndrome أخذناها, submucous lipoma or other tumors. شنو الباثولوجي اوف interception؟ طبعا الانترسبشن يتكون من 3 قطع. الانترنج اللي هو يسمونها inner tube or retaining middle tube, والشيث اللي هو outer tube اللي هو interception. The part of the advances is the apex العفو. The mass is the interception and the neck is the junction of the entering layer with the mass. Interception is example of strangulated obstruction. عادة lead to the impaired blood supply to the bowel, as the blood supply of the inner layer is usually impaired. The degree of the ischemia is dependent on the tightness of the invagination, which is usually greatest as it passes through the ileocecal valve. Interception may be anatomically defined according to the site and extent of the invagination. For example, بالinterception ممكن يكون is ileocolic اللي هو عادة بالchildren. Colocolic interception is also common in adult. Okay. Valvulus, another example of mechanical هو valvulus. شنو الvalvulus؟ Valvulus هو twisting or axial rotation of the portion of the bowel about its mesentery. يعني تفتر حول المزنتر مالتها. When the complete it form a closed loop obstruction. هم يصير obstruction بالبروكسيمال والديستال part of the bowel اللي مفترة, with resultant ischemia secondary to the vascular occlusion. Valvulae may be primary or secondary. The primary form occur secondary to the congenital malrotation of the gut, abnormal mesenteric attachment or congenital band. Examples include valvulae neonatorum, cecal valvulus, and sigmoid valvulus. Secondary valvulus, when there is cause, which is most common variety, is due to rotation of piece of the bowel around acquired adhesion or stoma. Okay, يصير valvulus. Sigmoid valvulus is the most common. This is rare in Europe and USA, but most common in our locality, Africa, Asia. Okay, and it's the most common cause of large bowel obstruction in the indigenous black African population. Rotation nearly always occur in anti-clockwise, يعني عكس عقرب الساعة, ومن نريد أرجعها لازم أمشيها with the way عقرب الساعة, من نريد أرجعها. أوكي, مهمة هاي. هذا الشكل يبين لك how to twisting of the sigmoid اللي هو either there is adhesions, overloaded pelvic colon عادة, large long pelvic mesocolon, and narrow attachment of the colon to the mesentery. What is the internal hernia? أهم واحدة من الأسباب of intestinal obstruction. Internal herniation occur when there is a portion of the small intestine will be entrapped in one of the retroperitoneal fossa or in congenital mesenteric defect. يصير defect بالمزنتري وتدخل السمول bowel وتنحصر. The following potential site of internal herniation: foramen of Winslow مثلا, hole in the mesentery, hole in the transverse colon, defect بالbroad ligament of the uterus, congenital or acquired diaphragmatic hernia, duodenal retroperitoneal fossa, cecal appendicial retroperitoneal fossa. هاي عادة potential foramens to the entrapment of the small bowel وهي عادة congenital. واضح شباب؟ Obstruction form enteric stricture. A small bowel stricture usually occurs secondary to the TB or Crohn's disease. Malignant stricture associated with the lymphoma are also common, whereas carcinoma and sarcoma are rare to cause stricture. Bullous obstruction. Bullous obstruction in the small bowel may be caused by food, gallstone, trichobezoar, phytobezoar, stercolith, and worms. نجي على كل وحدة من عتين. Gallstone. This type of the obstruction tend to occur in elderly secondary to the erosion of the large gallstone through the gallbladder into duodenum. وتروح تتحرك من الديودينام to obstruct the narrowest part of the bowel اللي هي عادة التيرمينال إليوم اللي هو 60 cm proximal to the ileocecal valve. واضح؟ عادة اللابراتومي may be possible to crush the stone within the bowel. ما يحتاج انه نفتح البول ونطلع الستون to relieve obstruction. اوكي؟ لانه الجول ستون عادة friable can be crush it within the bowel وتنحل القضية of the gallstone ileus. Food. Bullous obstruction may occur after partial or total gastrectomy. راح من يبلع المريض يبلع فماكو ذاك ما عنده ستومك حتى will be تسوي absorption and breakdown of the food, so it is unchewed article can pass directly to the small bowel leading to the obstruction. Fruit and vegetable are particularly liable to cause obstruction. Trichobezoar and phytobezoar, those عادة يصير عند psychological upset female, young female, psychiatric patient will be swallow the hair. okay, تبلع الشعر مالتها فعادة نسوي لنا ball inside the stomach lead to the obstruction. هاي called trichobezoar. or phytobezoar اللي هو due to vegetable or fruit will be swallowing without chewing lead to the obstruction. rare لكنه موجودة. worms, ascaris, lumbricoid may cause low small bowel obstruction, particularly in children, the institutionalized and those near the tropics. عادة ذولا اللي بالمعاهد اللي الأطفال المتروكين بالرعايات الاجتماعية يصير عندهم ascaris lumbricoid بكثرة ممكن يسوي intestinal obstruction. clinical feature of intestinal obstruction. طبعا clinical feature diagnosis of dynamic intestinal obstruction is based on the classical quarter of clinical pain, distension, vomiting, and absolute obstruction. This is a cardinal symptoms of the intestinal obstruction. Depend on the small bowel obstruction, large bowel obstruction. السمول it is high or low كلها تعتمد عليها الكلينيكال